Well, you're probably getting reminders at work. It's sign-up season for healthcare. Open enrollment is happening now, but do you know what to look for?
We're talking with the largest publicly operated healthcare plan in the U.S., and we're joined by Mildred De Jesus of LA Care Health. Thank you so much for joining us, Mildred.
Thank you for having us.
So the open enrollment date's November 1st through January 31st, and is covered California affected by the president's efforts to repeal and replace the Affordable Care Act?
That's a great question. Here in California, the Affordable Care Act is strong and is here to stay. Nothing is changing. We are all committed to continuing to provide access to affordable health care to all of California.
Well, it is so confusing. It's very hard to find the good, right health care for you and your family. How do people shop and compare to make sure that they're getting the best and most affordable health care for them?
There are many resources out there for Californians. Here in Los Angeles County, we have our website, lacare.org, lacarecovered.org. Of course, throughout California, they can shop and compare on coveredca.com. And there's also great information on healthcare.gov.
Okay, there's a lot of fear out there that insurance subsidies are going to go away. What's the status on that?
That's also a great question because it's very confusing with all of the information coming out of Washington, D.C. at this time. It's important for viewers to know that there are two subsidies. There are the subsidies that are provided to the health plans, and then there are the subsidies that are provided to the people. What is going away are the subsidies to the health plans. And the fact that that's going away will have no impact on the premiums offered to the people. So the subsidies, the assistance in the premiums will be there for everyone, for the consumers, yeah.
Wow, so would it mean that the prices might go up if the healthcare companies aren't getting these subsidies?
Premiums may go up a little bit. However, the subsidies will also go up to assist. So the people will see very, very little impact in their premiums. Also, we want to let everyone know that LA Care Health Plan is offering the most affordable plans in Los Angeles County for the silver, gold, and platinum levels. And that's very, very important. Those will be effective January 1st.
Okay, well, can you talk about some of the mistakes people make when they shop for healthcare?
Sure. One of the major mistakes is to wait too long. So, for example, as you said, open enrollment is here from November 1st through January 31st. However, December 15 is the deadline to apply and have no gap in coverage, which would begin January 1st. If you wait till, let's say, after December 15, you may not have coverage until February 1st. So there'll be a gap. Another thing to remember is as you're completing the application, you will need information such as your household, the number of members in your household. You will need your household income, that is your annual gross income, as well as documentation to prove U.S. citizenship or legal permanent residency.
All right, Mildred De Jesus, thank you so much for joining us. And
you're very welcome.
It is a confusing thing, and it's so many different tiers, and so thank you.
You're very welcome.
Yeah,
thank you.
It's hard to sift through it all. Thank
Absolutely.
you. Open enrollment again runs through January 31st, and for more information, you can go to coveredcalifornia.com, coveredca.com, and find out more about the LA Care Health Plan at lacarecovered.org.
Yes.
And thanks again, Mildred, for joining us.
Thank you for having us.